There we go. I was on mute. Hi, everybody. Welcome. I have a few participants who have their microphones on. If you wouldn't mind muting yourselves. Appreciate that. Great. Thank you all for being here. I am so excited to share this class with you and the information therein. Thank you for spending your Sunday afternoon with me. So my name is Kate Pearl. I'm your guide today, and thank you for coming to the MasterClass on Touch and Psychedelics. We're gonna jump right in. It's 1:03. I don't want to waste any time. I am, however, solo. I'm without an assistant today, so I will be fielding the question chat. I will be opening it up at certain times for questions specifically, but fielding that and also letting in participants as they trickle in. Expect a few more people will be a little late. So, but otherwise, we are just getting started right now. So this class is going to touch a few of the high-level topics that are included in my course called the Intelligent Touch Program. This is a training program for licensed touch therapists who wish to get more familiar with the field of psychedelics, psychedelic medicines, gain greater understanding about how somatic touch work can integrate with these medicines and create better treatment options now and in the future. Just a quick question, and hold on 1 second because I want to see all of your beautiful faces, and I am on gallery view. So let's see here. Sorry, I'm having a moment why I can't see everyone else's video seems like they're off. Is that true?
No, that's.
There we go. Thank you. Thanks, everybody. I would love to see anyone's faces who is here. It makes presenting a class a whole lot more interesting for the teacher. Not that you have to feel obligated for that, but at least I know who's on the call with me just for a moment. You're welcome to turn your cameras off if that's more comfortable for you, of course. Thank you, thank you, thank you. Okay, beautiful. So just, I'm curious by a show of hands here, who is, or just, you can drop a me in the chat, who actually is a touch therapist currently? Great. Yeah, there's several of you. Okay, wonderful. Fantastic. So so this course is for you. This course is also for any psychotherapists and mental health practitioners who want to know more about how to integrate somatic touch, or why somatic touch may be important to integrate into their practices as well. For all you touch therapists, this is information that can help you position yourself in the field when it will be time to need your expertise and training as these medicines pass through the legal corridors in the upcoming months. So if you've been following along, there's a great anticipation and preparation for this time where these medicines are going to be made legal. And we're at that very precipice now. So a couple other brief questions, and I'll just make these easy by having you. This one, y'all can drop a me in the chat if this is you. Just by a me of written text. How many of you have ingested or taken a psychedelic substance in the last 5 years? Yeah, great. Good, a good portion of you. And I'm curious, from a scale now of 1 to 10, 1 being like you're brand new to this, and 10 being everything there is to know about the medical research. How many of you are aware of the ongoing medical research with psychedelics? And that could be any psychedelic really that you're into right now, if you're working or interested in working with MDMA, which has the upcoming impending legalization, or psilocybin, or if you work with ayahuasca or 5-MeO DMT. Okay, yeah, so there's a good knowledge bed here. Fantastic. And then lastly, maybe by a show of me, how many of you are keeping abreast of the impending legal and policies around these substances? See, me's. You can say not me if that's the case for you too. Great. Okay, wonderful. Yeah, we will be going over, well, I won't be going over much of the legalities in this particular masterclass, but there's a wealth of information to be shared in the future from here. So I just wanted to get a sense of who's here and what the interest is, what the knowledge and understanding around this work is, and and then be prepared for questions, for your questions when they come in. So, furthering this, there are dozens of psychedelic therapy training programs out there. So currently, mostly they're available to licensed mental health practitioners. I created this program because I really saw a great need for therapies such as massage and body work and really any manual therapy that is an intrinsic part of the growth of this field of healing, is what I believe. So because as humans, we know that we can't just work on the mind and leave the body behind, and we know we can't work on the body and leave the mind behind. It really is a mind-body path to wellness. And when we engage with this, we really see major strides in quality of life. And that includes when you're working with clients and patients with PTSD, with depression, with high anxiety, with any nervous system disorder. So there's so much of the store of the soma that holds our story, and that story is often part of what's happening in the mind too. So that's really the premise for why I've created this body of work and what the masterclass is going to go over. And really to have touch therapists who are familiar and trained in this how therapeutic touch affects and can impact our sense of self, and help recalibrate our reality within and after going into non-ordinary states of consciousness. This is going to be an integral part of supporting the work with the rollout of these medicines. And if you've already been doing this work underground, you know the impact that this can have, and that will be amplified once these medicines are rolled out legally. So this has really been the call, and that's been the inspiration for me in creating this content and the program for working and training with others. So I'm just going to share a little bit about myself, and then we're going to hop into the content. I'll give you an overview of the next chunk of time we're going to spend with each other, and we'll go from there. So I have been a touch therapist for over 20 years. I started my education in massage therapy after I had sustained 2 major injuries, one of which was a traumatic event that resulted in a long-term spinal injury that I healed over a 10-year period with the help of many healing hands. And I was also able to gain a lot more freedom and stability, both physically and mentally, from those injuries with the help of psychedelics, and not just psychedelics, but also breath work and meditation. So I've worked mostly in private practice throughout my career, and also alongside conventional care treatment centers, working with physical rehabilitation patients, with mental health patients, as well as with professional athletes, high performers. But I think my most rewarding work has really been with helping the integration of challenging life experiences for people, as well as the integration of plant medicine work and other psychedelic experiences. It's really my favorite thing, and where I see the biggest impact and change happen. So for the past year, I've been conducting research on the impact of touch therapy and when it's used in conjunction with psychedelics within a journey and post-journey space. So I will be sharing more about that. I do have some research that you can partake in and participate in as well. I'll share more at the end of the call about that. So now that that's out of the way, I'll also share that this is about a 2-hour class, so we will have a bio break right in the middle and then return to question and answer. So the overview of the rest of our call is going to look like this. We're going to have about 75 minutes, an hour to 75 minutes worth of content, depending on how quickly I can get through it and clearly at the same time. We're going to learn about the neurobiology of touch and how it helps us form our nervous systems and vice versa. We're going to talk about the role of neuroplasticity and how our minds change as well as our bodies. We'll also discuss how gene expression, epigenetics, can be impacted by both touch and psychedelics. All of you touch workers, I'm sure, are already aware of this, or will be more in-depthly aware of this as we go on. And lastly, I'm going to talk about the importance of embodiment in the experience of this work. So once from there, I'm going to open it up for any questions and answers on the content, and then also have question and answer period for the program itself, if anyone is interested from there. So let's get started. I am going to first start us off by dropping into a short meditation. So if you want to get comfortable wherever you are and close your eyes, get your feet on the ground, or at least your seat on whatever surface you're on, make a nice firm contact there, and let your eyes start to drop closed. And just get in tune with the breath. And I want you to draw your awareness now to the surface of your skin. And imagine that you can be aware of the entire surface of your skin all at once. And don't get discouraged, this is not an easy feat, but just try to expand your sense of tracking and awareness to all of the surfaces that you don't often think of, maybe, you know, the backs of the knees or the webbings of the fingers and toes, the sits bones, where you're making contact with whatever surface you're sitting on. You can think about your armpits, the insides of your arms, all of those little nooks and crevices that are still on the outside of the body. So really drawing your attention close to all of the surface, seeing how aware you can be. Just feeling how the air around you is making contact with all of those light hairs. And from here, I want you to now absorb your consciousness, so to absorb your awareness in through your skin like a sponge, so that it sits now just on the opposite side of your skin, on the inside of your body. Like a sponge sucking in your attention. And then be there and see how much awareness you can expand into realizing and noticing the entirety of the inside surface of your skin. Again, that's like the insides of the feet, the bottom, the soles of the feet, the insides of the skull, insides of the face. And then letting your awareness now sink even further into the soft tissue and the viscera of the body. So bringing your awareness, all of the squishy, soft, some very firm, some very squishy and soft tissue. So that's muscle tissue, it's fat, it's organ, it's fascia. Letting your consciousness just sit and kind of swim around in that soft tissue, noticing it three-dimensionally. Remember, you've got a pretty dense, solid core of tissue that we're going to next, that most of that soft tissue either is surrounded by or surrounds. So tracking that soft tissue. And then from there, letting your awareness now draw into your skeletal frame. Just noticing the texture of your awareness as you bring the skeleton into your view, your inner view, or your attention. And just noticing how that feels to sit with your awareness in your skeletal structure. Very different texture, different layer of the body here. And from here, you're going to let your awareness now absorb one layer, one layer more, and bring your attention into your core. Into your core. And notice now that the core is not actually a physical place, not like the layers we've just been through, but it's our core. And wherever that center of meeting is for you, there's a sense of our own awareness of what our core is, even though it does not have a physical dimension. Just notice what it feels like for you in this moment to sit at your core. And then slowly we're going to move out from our core now through the layers back into bringing the skeletal system and your whole bony structure into view, all the way up from the metatarsals to the skull. And then expanding your awareness out into your soft tissue, your viscera, your organ systems, all of your blood vessels. Bringing it back out to the inner surface of the skin, and then slowly letting it seep out to the surface of the skin now and the room around you. And when you're ready, you can slowly let your eyes open, bring your presence back into your room. You've made a beautiful journey from the center of yourself back to the space around you. Great. Just a little centering exercise. And now I'm going to set up sharing my screen, and we're going to get into some really juicy stuff. Okay. So, touch and psychedelics. One of my favorite topics. So touch is our very first sense. Touch is an essential part of our existence from conception, essentially, but also, but more importantly, we begin processing our sense of touch as early as 8 weeks after conception. So from our gestation chamber, from an embryonic state, we have this experience of being a nervous system, being a central nervous system, and our brain is forming, our body is forming. As in this embryonic state, as our neuron bundles begin to elongate, to form out of the central nervous system into the peripheral nervous system, they make contact with the rest of our body. So if you can think of yourself like a little stem that starts to grow tendrils, and these nerves, these neuron bundles that are our nervous system, start to make contact with the rest of our body, and they grow from the spinal column to become the peripheral nervous system, and those nerve endings then supplant themselves in our skin and become our mechanoreceptors, which form the functional net of our touch receptivity. This is all happening within the gestation period. So these mechanoreceptors in our skin then relay information and provide feedback about touch sensations to the central nervous system, helping it develop further. So it's this feedback loop where the central nervous system grows the nerves start receiving information, they bring it back to the central nervous system, and our neural connections start to grow from there. And that is literally how our sense of touch is developed. It's really such an incredible process. So on the screen here, just going over those points, we believe that our sense of touch starts as early as 8 weeks after conception and starts to grow from there. The central nervous system becomes the peripheral nervous system and innervates the soft tissue of the body. So all of these yellow markings you can see on the image of the child here, that's the peripheral nervous system. The nerve endings of those become specialized cells in the skin. Those are our touch receptors. That is what becomes our sense of touch. And they give information back and forth from the surface of the skin to the central nervous system. So this can include things like pressure from the uterine walls, and even pressure from the womb, from somebody touching, the womb of the mother or something like that. So an awareness starts to build. So just going over that really briefly, central nervous system consists of the brain and the spinal cord. Peripheral nervous system are the nerves that branch out from the brain and the spinal cord. And then we've got this lovely illustration over here I borrowed from the Christopher Reeve Foundation that shows you the central nervous system here and the spinal column, so you can see where some of these nerves originate in the spinal column and then where they travel to innervate from there. So the role of touch is key in our brain development. The input of touch becomes a stimulator for our growth. We begin sensing and feeling our neural connections increase because of this input. And that all is happening in this 9-month gestation period. But once we are born, obviously, once we are come out into the world, those neural connections really obviously rapidly increase. So from there, studies know, research has found that there's a direct correlation between our nervous system and our emotional regulatory system that begins with these signals of touch that our developing nervous system receives after birth. So once we're in the outside world, touch serves to build and strengthen our stress response system and our emotional regulatory system, and it actually literally helps it develop its capacity. So this is the capacity that enables our children to self-soothe, to self-regulate. There's so much that develops in the close contact of a caregiver and a newborn. And I don't know if any of you have ever tracked the studies with premature babies, but they have shown that premature babies who receive specific types of touch, soft, gentle, nurturing touch that has emotional content to it, called afferent touch, caring, loving touch, which is a very natural process between a caregiver and a child, really. They see increases in the cognitive development of these premature babies and the weight gain of premature babies far exceeding what premature babies who do not receive this touch develop with, which is just incredible information about the nature of touch and how it is so intrinsic to our own development as human beings. So I just want to check in because I can't see anybody here, and I want to make sure there's no questions in the comments so far. And I do want to say for everyone new that's come in, welcome. And there will be a question and answer period at the end of the class, and depending on how the class is going, I'll open it up for questions that people may be having. But so far, so good. Is this all absorbing for people? I see a thumbs up. I see some nods. Awesome. Great. I've got my screen share, so I can't. Now I've got some gallery view. So great. Okay. So what we know about touch. Touch travels from the surface of our skin to our core. This is like building the wires of our nervous system, like literally from our skin to our brains. We know that healthy touch facilitates emotional regulatory system development. So this is like pro-social development and higher capacities for empathy, for caring for others, for kindness and sensitivity to others' feelings. There is the research, this is the part where afferent touch really comes in, this gentle, nurturing touch stimulates these areas of the brain that are associated with what's also called the social brain. And repeated touch and care of this order really strengthens those neural connections. So I did mention there's the studies on preemie babies, but there's studies that look at the positive impacts of touch on brain plasticity at different stages of early childhood development from in utero all the way up to 5 years of age. The literal touch, not in utero, but the sense of touch and sort of this caring, like realizing the child, realizing there's a presence and there's someone touching the womb, and the murmuring of a mother's voice, also being a developmental sort of builder for their systems. Okay, so that really is the basis for, you get to see how touch actually has a very intrinsic role with how our genes express themselves. I mean, that is epigenetics essentially, as we're being built, and the way that our genes decide to create an optimal expression with the opportunity to have that kind of a loving sense of touch. I took this definition right from the CDC website because it's very clear, it's accurate. And in this way, I feel like the quality of touch we receive actually, we are wired for this kind of touch. So I'll just read off here. Epigenetics is the study of how your behaviors and environment can cause changes that affect the way your genes work. Unlike genetic changes, epigenetic changes are reversible and do not change your DNA sequence, but they can change how your body reads a DNA sequence. So this is obviously a huge, I think it's an awareness that is not really widely known as far as what kind of power we have in our hands to actually shift. And it's a nuance, but it also is being scientifically tracked now, which is an incredible reinforcement of like what really happens in the exchange of touch. And we haven't gotten to the adult phase yet, because as adults, we're obviously much less wired for plasticity. We already have a lot of neural connections, but we also know it is possible to shift and have neuroplasticity in the brain. Neuroplasticity intrinsically affecting our epigenetics and how our genes express themselves. So by reading biological markers, we have a very unique window into how the emotional regulatory system and the stress response system is operating. And these positive interactions can be elevated with the right kinds of touch. So because touch can change your behaviors, how you're engaging with your environment, lower your stress, relieve pain, etc. This all has an impact again on how our genes are deciding to express themselves, what hormones and neurotransmitters are moving through our systems. So let's see. From here. So epigenetics and trauma, for instance, and I'm not going to go into trauma much on this call because it's such a massive topic, but it's a great example of how we can see epigenetics as our lived experience. So you might have one expression of genes before a traumatic incident, and then your genes are shifting and creating a different kind of expression after traumatic experience. So that's hence the lived experience becomes our epigenetic impact, or can become our epigenetic impact. In fact, they've done really interesting studies on, I was reading one study that shows the generational impact of some of this lived experience from a mother who had lived through a very traumatic incident. This particular study was citing 9/11, and the increase of cortisol in their systems was, if they were pregnant at the time, they were able to track the impact of that on their children years after the event. That was a really eye-opening research done as to how generational impact is actually passed biochemically and not just through behaviors and environmental change. Like, you know, if you're dealing with a parental impact because of something that's afflicted them or how you've been treated as a child from your caregiver, that's environmental, you know, that's an environmental behavior that can have an impact on you and your lived experience. But there's also this biochemical piece that can, you know, go beyond, you know, just being able to change or get out of a behavior that makes it much more complex when we're dealing with the world of epigenetics and how we actually instigate positive change for more optimal health and well-being or quality of life. So psychedelic research is now able to give us more detail into the alchemy of experience, lived experience to epigenetics. And we're seeing this with all of the clinical studies that have been passed through. And due to the scrutable evidence of the improved mental health and symptoms of the psychiatric disorders, obviously through psychedelic assisted therapy. So, and this is particularly true for otherwise treatment resistant cases, is what we're finding with trauma, post-traumatic stress disorder, and other stress related experiences. So that's really incredible. I feel like this is such an exciting time to be doing this work and seeing some of the growth that's possible. And just to go back to and I'm saying this again, but in a slightly different way, science is finding that generational trauma, emotional trauma, and environmental trauma, including the environment of our home life and social settings, all have this active impact on the expression of our genes that we, at any opportunity to be able to shift that is an opportunity that I think it's wise to take. So the question is, can we reframe our associations, such as how we form self-image, build self-confidence, and create comfort and safety in our own skin as adults, and obviously create healing opportunities as adults? So I'm going to take this to a more anatomical piece here, yet again, talking about the somatosensory system. So the somatosensory system is a region of neurons in the brain responsible for processing the functions of our kinesthesia. Our kinesthesia, and the general definition for here for all intents and purposes, is how our body feels as it exists in space. And the breakdown of those components are really proprioception, interoception, and exteroception. So you've got proprioception, which is your mind's ability to sense where it is in space. And this definition, depending on who you ask, changes a little bit if you've heard slightly different variations of this. But for our intents and purposes, this is how I'm defining it here, and the exteroception and interoception. So it's how you're aware of your body's movements, actions, and location in space, how far you are from the wall next to you, how far you are from the person across from you, how your arm is moving through space or not moving through space. Exteroception is your awareness of stimuli that originates from outside the body, and how it can be impacting or influencing your awareness of where you are in space. And then the interoception is your ability to sense what's happening in the body. Is your heart pounding? Is your temperature rising? Are you starting to feel anxious? Is it coming from an external stimulation that's now impacting you, or is it happening on the inside only? So those are really important components of interoception. And all of those items originate in the somatosensory system, which is originating from the somatosensory cortex, which is a part of the brain located in the cerebrum, which is where we actually form our understanding of our body. There's I'm gonna switch quickly to the next page so you can see this, but this is a cross section of that region of the brain where you literally see the surface of our bodies is mapped on this part of the cortex. I don't know if you've ever seen this image before. I know the first time that I laid eyes on it, I said, wow, because that's how incredible our brains are and how specific it is to how we are mapped and how the connections between our mind and our body actually are. So this map is drawn, it's called the somatotopic map, where you have the outline of the body. It's like a topographic map. This is a map of your body on your brain. And it's drawn in such a way that the larger portions here that are represented, like the hands, the face, the lips, the genitals over here is female genitals, obviously. The tongue, you are drawn larger because they have more touch receptivity. There are more touch receptors, mechanoreceptors in those locations. So just going back a slide here, we know that this cortex, this portion of the brain, is influenced heavily by touch experiences. The development is. Studies have shown that early tactile stimulation is crucial for the proper organization and refinement of the somatotopic map. And remember, we're talking about our kinesthetic sense, our kinesthesia, our sense of proprioception, our sense of awareness of where we are in space. And for our intents and purposes, for this kind of learning environment, it's like the nuances of where we are in space, where tension is being held, where we're not able to access a movement or even let our bodies be aware of a certain muscle or entrapment in the body. In animal studies, they've proven that, or shown, I should say, that depriving newborns of touch experiences disrupts the development of the somatosensory cortex. And lastly, I think this one is really highly interesting, is that our general self-image is constructed within the somatosensory cortex. So what this means is the way that we see ourselves. In that it can be literally in the mirror, but also literally like through other people's eyes, or just how we think of ourselves in the world at large. Is that there's a self-image construct that is formed in the somatosensory system. So there's a study that was done by the Neuropsychoanalysis Foundation. They published a study where they found that there's evidence to support the existing idea that interoceptive signals, such as affective awareness of effective touch, like something that's just gentle and soft on the outside, plays an important role in how our brains learn to construct a mental picture and an understanding of our body. So it's the mental picture that you have of yourself. And in addition to that, decreased sensitivity and less awareness of the interoceptive signal has been linked to body image problems, including like unexplained pain and body dysmorphias like anorexia and bulimia. And there was additionally another study, and I'm throwing a lot of like, there was a study this and a study that, but you can go and search these on the internet. And I do have them in a comprehensive bibliography if anybody's really interested. But they did a study with teens where they showed that this sense of interoceptive awareness was directly linked to self-confidence, which is like, the implications there are exciting. And I think, for me, it's the continually coming back to the importance of mind-body medicine, like how intrinsically linked we are, and that there are really components that show how we're linked. It's not just a theory. It's not just a mystical, like, oh, mind-body medicine. There's real, there are real tangible pieces to this wiring that connects our minds and our bodies together, that the more we know, the more we can work with. So going to this next slide, the plasticity of the felt sense. So the felt sense is our touch, our sense of touch. So the touch therapists here and anyone who loves to work with touch, what we know experientially as touch therapists is that it is possible to increase subjective sensory awareness and to melt tension and to de-armor musculature around corresponding body parts. So whether that awareness was never there or whether it was there at some point and then got armored. And when I say the word armored, I just mean that there's something stuck there that a person is either not able to mobilize or isolate a certain muscle or a certain body part, and they're not able to connect to it. If you've ever been with a client who you say, can you relax your shoulder or something like that, and they're holding their arm stiff like this, and they're like, I am relaxing it, and there's you have to walk them through. I mean, the way that I've successfully navigated that is walking them through a reconnection to their shoulder so they understand, oh, I was holding it up the entire time. That's what it feels like to have it at ease and with space to move. And there's a reconnection, a reawareness, a reawakening of their ability to isolate that area and to de-armor it, so to speak. So that's the way I'm using the word armor, and the word to melt tension. And sometimes you may be working with patients who have never felt certain areas of their body before. I don't know how many of you have ever worked with somebody where they say, wow, I had no idea that I've never felt that part of my body before. Like I can feel myself move in a way I've never felt before. And that is a new connection made. That is a set, what I call a plasticity of kinesthetic awareness, where and the more that they practice that conductivity, the more they're going to have access to going, oh, my shoulders have been living around my ears for the last 10 years. And we're talking about really simple things here. You know, we're obviously not talking about major pathologies and terminal illnesses, but this is just like stress responses. And as we know, stress can create a lot of those pathologies. So any way that we can assist stress moving through the body and opening that by the plasticity and the building of the kinesthetic awareness, helping generate education around kinesthetic connection, all of those things are super, super valuable. So just moving on to number 2, it is possible for patients to grow an increased awareness of emotional and or psychological elements within their kinesthetic awareness. And again, it's, I think, a common theme with touch therapists where there's an intrinsic saying called our issues are in our tissues. And the more that someone can awaken to understanding that if there is an emotion or some kind of a psychological process that's in a part of that connected to a part of their body or connected to a trauma in their body, the more access they have to really unraveling and undoing some of that. And again, I call that a sense of plasticity, where there's a way to relearn, or there's a way to create more learning around how our mind affects our body, or where they've been holding anger masked as tension, for example, in their body. And I'm really curious, just by kind of going on here on the course material, but I'm curious just by a sense in the chat. You can drop a me in the chat again, as far as who here has experienced that in your client base, with people kind of awakening to some kind of emotional connection in their physical body, and also the de-armoring correspondence of like people having epiphanies around, oh wow, I'm feeling a new area of my body I've never felt in motion before. Yeah. Awesome. All right. So the next slide here is, where does touch fit into all of this? So I haven't talked about psychedelics a lot. It's really been focused on touch, but the psychedelic aspect is really this opportunity for greater access to healing. So we have all of these incredible epigenetic changes we're seeing with the clinical studies, and the improvements of otherwise treatment-resistant patients, and the vast interest that people have in alternative methods to healing. And when I say alternative, I just mean methods that have not yet been offered. I don't mean that they're necessarily in the alternative space, because I do believe they're moving into a much more broadband space. But with the rollout of these types of treatments, we really are having the science and the effort by the scientific community being backed into saying, what is possible? How do these things actually change? What genes actually get shifted? How does it happen? How does neuroplasticity affect the rest of us? And, with touch therapy, these things have been happening for a long time, but it's much less studied as far as touch and massage and bodywork has been on the fringe of any kind of allopathic treatments or any kind of what are considered serious medical treatments for a long time. And they've really come into mainframe where they're being valued now. And I again, just going back to what I shared in the beginning of why this is so important, there's such a somatic presence in anything we do with mental health, and being sure that we're really taking care and stewarding how these medicines are working through us, with touch being touch therapies being represented and being an intrinsic part of people's reconnection and growth to their bodies and to new places in their well-being. So we've got this arc here on this beautiful slide where preparation is the beginning. We go through the journey. I slipped embodiment in there because I think that there is something that happens in between the journey and then the integration phase, which the integration phase can be, it can start in the journey or it can be all the way out to, years past a journey experience. But there is something in there that happens. I don't think embodiment happens after integration. It happens either conjoined with or as kind of a bridge towards integration. And really, touch fits in all of these places. When you're working with touch in preparation for a journey, you are working to open the body, to get the mind relaxed, to open the pathways in the body, to impact lymphatic flow, to impact blood flow, to get those feel-good oxytocin, chemicals moving through the body, and give your patient the most receptivity for absorption of what their journey is going to be, creating a good base for them to move into their journey from. In the journey itself, there are also application places where touch really works, and finding those places is really, I think, the challenge. And I'll talk about that more because that's really what the program is based on, is like, where do we put touch into, where does it really fit in? How individual is it to each unique person? And how do I, as a therapist or somebody who's facilitating this work, how do I actually assess where touch is going to be the most beneficial? So we've got places within a journey, depending on the medicine you're working on and depending on the person, where touch can really be beneficial. And then, of course, the embodiment phase and also the integration phase, which is, I think, where most touch has been happening at the current phase for anyone who's been working in these fields. Integration with bodywork has been sort of the first step of seeing it as a beneficial tool. And we're going to expand on that more as to how and why it's a beneficial tool, but it's incredibly beneficial in the integration phase, continually alighting on the waves of neuroplasticity that's open within a certain time period after a psychedelic journey, and letting the body really be massaged, no pun intended, with that kind of awareness, as well as what's been happening in somebody's mental space, in somebody's mind space. Okay, so the challenge. I think the challenge here is discerning not just how, but when and why we use touch with these kinds of treatments. And I think how to apply touch safely, how to discern when it's appropriate and beneficial to the patient is of the utmost concern. And when being able to discern when your touch is going to be detracting from the experience rather than assisting. It's much like the presence of a psychotherapist in the psychedelic assisted therapy sessions. They have really hands-on experiences, and they have experiences where they really let the medicine do the work. And these are different approaches, and they're not equal, or they're not equally great for every person. But for the person who's going to prefer some touch assistance, it is. This is, part of the content that's really going to be beneficial for their process. But then the further step is saying, when within a session is it going to be beneficial for this person? So, and furthermore, I think the challenge is that not all sessions are equal and alike. There's, so many different styles of body work and touch therapy, and barely any to manual therapists are alike. We all have usually a lot of different tools and modalities in our toolboxes. So some styles of therapy are going to work for some patients and some styles won't. And the same as, that's any touch modality. And it's up to the therapist at hand to decide what tools do I have in my toolbox that are going to be appropriate to use with this client and in this heightened space of awareness that we're in. And that can be prior preparation within the journey space or within the integration phase. And that's something that's it's a session process. It's a process of discovery that you have with your client. And this is part of the program that I've built, is really discerning what those methods are and how you work through this process with each client to discover what's going to work for this person. How do we map out what a session actually looks like and why we're doing what we're doing? So it's really a fine attunement to work with each person as they come to you, and while being familiar and comfortable working in this space. Yeah, so some clients will resonate with deeper effective touch like deep tissue myofascial, while others will gravitate towards gentler styles like Swedish massage or therapeutic touch work, biofield work like Reiki, and energy healing that can also have a major impact on our nervous system regulation. So all of these are considered in touch therapy work. So just gonna dip in the chat here and see what it says. Oh wow, you're an MT, Megan. You're an MT at Google Office. Often engineers are very immune to their body. Yeah, it really is. I feel like there's an epidemic of people who sit at their computers for work, that you just become all mind and you forget about the rest of you. So there is sort of this, and it actually is an epidemic. We see it in how our bodies have changed and what kind of physical issues we're actually having in our bodies versus when we didn't work at computers, when 60% of our workforce did not sit down in chairs at our computers for hours on end. So it's really fascinating when you're tracking all of those actual shifts in our biology or in our anatomical sort of proclivities. Yeah, agreed. It's really changed in the last 10 to 15 years. So just want to say a few more things about our ability to track as touch therapists, or as for any psychotherapists or mental health practitioners who are on the call. Thinking about this in a way of how touch can affect, how somatic work can affect your client and create more assistance, more support, and more co-regulation. Certain techniques of touch that you're choosing, why you're choosing them, and you're tracking what your biological working signs are. You're watching to see that the nervous system is decompressing as you're working, it's resetting. You're looking for symptoms that the musculature is dearmoring itself. There's more oxytocin being generated. There's more parasympathetic mode that is being activated with your touch, and to see that the body is open to receiving the suggestions that touch is inviting for release and recalibration. If you have a hand on somebody's shoulder, on somebody's head, and they're starting to tighten up, those are the messages, obviously, that you're looking to say, okay, is this detracting from the experience, and how do I engage with this person to inquire? Or do I just remove my hands and then watch for those working signs to see what happens? And a lot of that is unspoken. It's very being very attuned to your client and really watching and listening for what the body is communicating. And of course, when there's doubts, verbalizing questions. And there's also things that you're tracking, like contextual factors around this particular client. Again, that's an all individual process. So any questions so far? I'm just I have one more slide to share, and then again, I am going to open up a Q&A or a conversation space for everyone, and then share a little bit more about the program as well. And we're running It's right on schedule. So it's just we've been here on the call for just under an hour. And before we do the Q&A, we'll make a quick 5-minute bio break for anybody who needs it. So, okay, nothing in the chat. Great. So when we think about all of these components working together and how the mind affects the body affects the mind, and starting to invite somatic touch work into this experience of non-ordinary states of consciousness with psychedelic medicines in a controlled environment, in a setting that's intentional with this work, we really begin to understand these developmental neural responses to therapeutic touch, and that it's demystified. There's a demystification process. It's not so mysterious, this bridge between the mind and body. Physical touch can change our mind, similar to how psychedelics can, lighting up a part of us and shining awareness on places within us that we haven't seen or we haven't had context for priorly experiencing them. I mean, those kinds of awakenings are incredibly valuable when we are walking into a better quality of life, trying to understand ourselves better. I think these channels of healing really come alive the more we understand these processes from a very, foundational, like grounded aspect, and our ability to affect real change in the body and the mind through a relearning process, through neuroplasticity, and through the shift of thoughts and feelings, and in collaboration with our bodies. So mind-body medicine demystified is part of the intention of this program, particularly for mental health practitioners who are not, working so much with the body and haven't seen it as even a necessary component yet. Yeah, there really is a call for more of that integration of how the mind and body mirror and work with each other. So